Okay, now we're going to work with Chapter 12, Medication Safety. So some of the objectives we're going to go over we're going to talk about the different types of medical errors that could occur in the different environments such as community pharmacies, hospital pharmacies, and so forth. Different types of medication errors, and I'll give you some examples. We'll actually go through the prescription filling process step by step. Medication error prevention. What can you do to help prevent different types of medical errors? Medication error reporting systems. There's a couple different reporting systems that you should be aware of. So these are our learning objectives. I'll let you guys just read through those. Okay. So next, of course, it's going to be a part of the pharmacy technician's job to help in the role in prevention of medication errors. Each workstation should be checked for errors. Okay, so medical errors result in unattended health outcomes. There's, of course, as many as 98,000 people die each year in the United States as a result of medical errors. So you want to double check behind other texts and at your different workstations for errors every time you pick up a medication. See, the pharmacy technician, of course, should be on the lookout for potential medical errors. So medical errors can be as simple as like a lab test drawn at the wrong time, returning an inaccurate result, or more severe examples would be a major surgical error that ends in death. But the definition, of course, of a medical errors, of course, can be difficult to define because circumstances that cause them are going to be indefinite or different depending on the severity. So a medical error is any circumstance, action, inaction, or decision related to health care that contributes to an unintended health result. So medication errors. Medication errors are among the most common types of medical errors. Medication errors result in an estimated 7,000 deaths each year in the United States. So these are just medication errors. About 1.7%, which is about 4 out of 250 prescriptions. So 4 prescriptions out of 250 of all prescriptions dispensed in a community pharmacy contain a medical error. So if you think about it, I used to work at a pharmacy that we would do maybe between 400 to 600 prescriptions a day. So you're looking at 4 out of every 250 of those, you're going to have 4 errors. So that's a lot. Not all medication errors result in harm to the patient. The same study estimated 65% of the medication errors detected had an adverse effect on the patient's health. So some errors can be mild, but some errors can be moderate and some can be deathly. So you do not want to make any errors at all. And this, of course, is a term to remember, medication error, which we've already went over. It's any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, the patient, or the consumer. So you have your medication errors could be by patient response. This is the outline of what we're going to go over. Categories of medication errors and the root cause analysis of medication errors. So it's just an outline of what we're going to go over those 3 topics on the next few slides. With patient response, okay, we have, of course, some medication errors have a physiological cause. Medications, of course, may not be properly eliminated, of course, from the body due to like an enzyme deficiency or decreased kidney function. So with patient response, each patient has a unique response, of course, to medications that can best highlight the importance of the medication safety. Another example, of course, of medications that may not properly be eliminated from the body due to different things like enzyme deficiency and decreased kidney function. Another example of it is age-related decrease. Many meds, of course, rely on the kidney for elimination of the body, or from the body, excuse me. So if the dose is not lowered, the medication may reach toxic levels. So some medication errors have a social cause. Patients, of course, can cause medication errors through incorrect self-administration. Um, so as a result, the medication will not work properly or may not work at all or may cause harm if they forget to take a dose or taking it at the wrong time, taking too many doses, not getting a prescription filled or refilled in a timely manner, not following dosing directions, or maybe if they terminated the regimen too soon. So it is important for the pharmacy tech to notice the refill history when entering an order. If a patient is being non-compliant with the prescribed medication, then it should be brought to the pharmacist's attention for counseling. Okay. When you're refilling a prescription for a patient, it will usually let you know if it's too soon, because usually your insurance will stop it. The day supply will be too soon to be refilled again. Or if they're not taking enough, you may notice that the last time they had taken it was, if it was a monthly dose, it may have been 2 months past and they missed a month. So things like that you would want to bring to a pharmacist's attention. So you have different categories of medication errors. One, of course, is your omission error. That, of course, is the prescribed dose is not given. So the next dose is due, but the previous one was not given, pretty much. All these categories, of course, the categories of medication errors help in the identification and prevention of possible causes. So you have wrong dose errors, as this is a dose given is 5% above or below the correct dose. Extra dose error is when more doses are given or taken than prescribed by the doctor. Wrong dosage form error, this is the dosage form incorrectly interpreted. It is not of course, not the one that was written on the doctor's orders. So an example of this one would be a drug is given by mouth, but the drug they ordered an intramuscular injection of that same medicine. Or a capsule form was given instead of a tablet, or an immediate release. Then you have wrong time errors, and that's going to be a dose given at least 30 minutes before or after prescribed time. This is a common error, of course, in the hospital or the nursing home, usually. So here are your terms to remember, and I'm not going to go back through those because I just went over them on that one slide. So you guys can have those on the separate things. So your medication error, of course, can also be characterized by the cause of failure. And that means, of course, they're going to be categorized within 3 basic definitions of failure. So an example, the first one is human failure, and that is when an individual mistake is made, of course, by the healthcare worker or the patient. So an example of failure on the healthcare worker would be maybe like the healthcare worker pulling a medication bottle from the shelf based on memory without cross-referencing the bottle label with the shelf label. So you always want to look at the NDC numbers to match it. And of course the medication order or the prescription number or the NDC number. So an example of a patient error would be maybe a non-compliance to prescribed drug therapy. So human failure is an error, of course, generated by failure that occurs at an individual level. The technical level or technical failure is an equipment malfunction. So an example of this, of course, would be an incorrect reconstitution of a medication because of a malfunction of the sterile water dispenser, or a failure to operate the automated equipment properly. An organizational failure is an error caused by rules, policies, or procedures. An example of an organizational failure would include a policy or rule requiring the preparing or the admixing of parenteral drugs in an inappropriate setting with proper environmental controls. And again, here are your definitions that we've already went over. Root cause analysis, of course, is of medication errors is a process to identify what, how, and why something has happened. And it's, in order to, of course, to prevent the recurrence using the root cause analysis, a person can examine his or her own workflow to determine the potential error and the type of failure that potential error may involve. There are a list of specific potential causes that can be identified. They are 3 of the most common causes are assumption errors, selection errors, and capture errors. So medication error by handlers and preparers of medications has many causes. But here are the 3 most common. Again, here is your definition of the root cause analysis. That is a logical and systematic process used to help identify what, how, and why something happened in order to prevent the recurrence. The assumption error, of course, is an error that occurs when an essential piece of information cannot be verified and is guessed or presumed. So an example of this would be a pharmacy tech might misread a poorly written abbreviation on a prescription. So if a prescription has a poorly written abbreviation, you should check with the pharmacist. If the pharmacist is unsure, they need to call the doctor or nurse to find out what they had written down. You never guess or presume, you always double check. Some examples of your assumption errors is when a pharmacy technician misreads a poorly written abbreviation on a prescription. Sometimes if they write QID, which reads 4 times a day, they may have the I so close to the D and it might be sloppy. You might just read it as QD as every day. So you do want to make sure that you, if you are unsure of what the doctor has written or the nurse has written, you need to double check with the pharmacist, and then sometimes the pharmacist has to double check with the doctor. So selection errors when 2 or more options exist and the incorrect option is chosen. So these are showing you some examples of your selection error. So when a pharmacy technician mistakenly selects a look-alike or sound-alike drug instead of the prescribed drug. So if you look at these drugs here, they are all drugs of your Depakote, but some of them they're different strengths in different forms. So this is Depakote sprinkles at 125 milligrams. This is just Depakote at 125 milligrams. Okay, this is Depakote at 250. And so forth. So you see like Depakote ER. So you always want to double check. And if you notice the bottles all look the same, they just have a little bit different color label at the top. So you do anything that looks alike or it may sound alike, you always want to check it against the NDC number. So the pharmacy tech should double check NDC numbers from the label to the bottle. The label should state the NDC number on it, and when you're pulling the drug from the shelf, you need to double check that label NDC number with the bottle NDC number. So capture error is an error, of course, that occurs when focus on a task is diverted elsewhere and therefore the error goes undetected. So some examples of your capture error is when a pharmacy technician takes a phone call in the middle of filling a prescription and thus miscounts the number of tablets. So if for some reason you're a pharmacy tech and you're working and the phone's ringing off the hook, which it probably will, the pharmacy technician, if they're interrupted by a phone call, then they should recount those tablets. Okay, so but you got to think about it. There is, is there a point in the process of which stopping and answering the phone is not appropriate? Of course, sometimes if you're in a situation where it is inappropriate to stop what you're doing to answer the phone, finish counting, or like if you're making a compound or you're compounding a medication, you need to compound the medication first, then enter the phone. Something like counting pills, that's something you could stop, enter the phone, then you could just restart over on counting. Okay. So when is it appropriate to allow for such an interruption? You need to just make that decision on your own. Sometimes your place of work will have certain rules that they go by. So knowing when to allow interruption and when not to do so is pretty much a vital, important role in maintaining the individual safety of the patients. So usually the place of where you work at will kind of give you some rules and regulations of what they like you to do. I've worked at a pharmacy to where uh, only certain stations entered the phone and certain stations did not enter the phone. Um, so it may be things like to that nature. And then sometimes you might get interrupted by a patient coming in to the pharmacy. So maintaining the focused attention when filling prescriptions is important, of course, to medication to avoid errors. Some questions to think about while you're studying your notes is, and I'm not going to answer these, I'll just let you answer them. Just to help you get you thinking about what you've already learned. So how extensive is the problem of medication errors? What are the costs of medication errors? So, you know, like what are the costs? The costs can be on, you know, money cost, but also can cost the patients their lives as well. So those are just a couple of questions to think about. Here are some more questions to think about while you're studying your notes. What are the 5 major categories of medication errors? Those are the ones we just went over, like omission error, wrong dose error, extra dose error, wrong dose error, form error, and wrong time error. And what are the 3 basic causes of medication errors? Assumption errors, selection errors, and of course encapture errors. So to find potential causes for medication errors, it is helpful to examine each step of the prescription filling process, and there are 3 parts to each step. So that is why we will go through each step of the filling process in more detail. As we go through those steps, we're going to look for things that we can do to help reduce any type of errors. So information that needs to be obtained or checked, resources that can be used to verify information, and potential errors that might result from a failure to check or obtain the information. So we will stop here and for part 1.